Hello, Clinic Review family. Today I'm finishing up what I started a couple days ago, talking about dangers and discomforts of pregnancy. Today we're doing the third trimester. So let's go ahead and get started. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews, the home of the very best NCLEX review in the entire universe, in my opinion. Mark Klimek does those online on demand. Y'all, he is a phenomenal teacher. He's literally taught me everything I know about NCLEX, about teaching, about writing questions. He has an amazing gift, and he does his NCLEX review is different than any other NCLEX review you can find anywhere. There's a reason why so many people love it so much. And I'm just telling you, if you have heard about Klimek reviews, it's because somebody else told you about them or somebody else recommended them, because Mark Klimek does not advertise. Have you ever seen any advertising for Klimek reviews? You might say, well, Sharon, you do advertising on YouTube by having this channel. You're right. We do advertising, but it's also on YouTube, as this channel is sort of like advertising for us. But we also offer a service through this channel. So Mark Klimek literally has never done any advertising. He has always said, I'm not going to advertise. If what we're doing works, people are going to tell other people about it. And that's how I'm going to know that what I'm teaching them is helpful. So he's a great guy. He's a very unique guy, pretty amazing. His attitude toward things is pretty phenomenal. So we also offer a small group monthly tutoring packages, as well as a streaming service. So let's go ahead and get started with our third trimester. This is in the Blue Book. You can get the Blue Book on Amazon, or you can go to clinicreviews.com. And if you look up at the top, it'll have different tabs, and you click the Blue Book tab, and you can get the app. Okay. So if you're outside the US and you can't order the Blue Book, or outside North America and you can't get the Blue Book from Amazon, you can get it. You can get the app. Actually, probably you can get Amazon in Europe. I have no idea. I've never tried to order Amazon in Europe. So if you can get the Blue Book in Europe, let me know, because I didn't know you could do that. All right, let's go. A client at 34 weeks gestation comes to the prenatal clinic reporting several symptoms. Which findings should the nurse report to the healthcare provider? So remember, we report unexpected findings to the healthcare provider. That's one of the prioritization strategies that I've taught you. You know, when they give you very little information about the client, all they do is tell you their diagnosis, or they tell you their 34 weeks gestation, which is third trimester. And then it says, what should you report to the healthcare provider? Or what should you be most concerned about? Or what requires your immediate intervention? You say the unexpected findings. So that means we're looking for things that are expected at 34 weeks, and we're not going to report those to the healthcare provider, because I, as the nurse, am expected to manage the expected signs and symptoms, the expected discomforts, the expected side effects, whatever it is. I'm expected to treat those or manage those, and I teach the patient how to manage those. Okay, so that's why you get so many teaching questions on the NCLEX, because the NCLEX expects you to identify expected side effects, expected findings, and to help the patient manage those. We're looking for the unexpected finding in the third trimester. The third trimester is from about week 25, 26 to week 36. And then 37 is full term. Now that's still the third trimester, right? But week 37 is full term. So from 37, 38, 39, week 40 is the average week that women deliver in the United States. And if the woman hasn't gone into labor by week 40, this isn't a testing question. I'm just telling you the reality. If you haven't gone into labor by the time you're in week 40, usually they'll schedule an induction for you. I have my own personal opinions about the medicalization of delivery, but I'm not going to get into that on the Klimek YouTube channel. That probably would not go over well. All right. A client at 34 weeks gestation comes to prenatal clinic reporting several symptoms. Which findings should they report to the healthcare provider? Increased urinary frequency during the night. That is expected discomfort during pregnancy. First trimester and third trimester is when they experience urinary frequency. Persistent headache and blurred vision. Headaches are pretty common because of the hormonal fluctuation, but blurred vision is not expected, and a persistent headache is really not expected. Occasional headaches is okay, but a persistent headache bothers me. Occasional irregular contractions, that's okay. It's actually the body getting ready for delivery, and so it stimulates the uterus to contract every once in a while. Those are called Braxton Hicks contractions. They haven't gone into labor. Irregular contractions does not mean labor. Regular contractions is labor. Mild ankle swelling by the end of the day. That's expected. Sudden swelling is unexpected. Mild ankle swelling at the end of the day is expected. Now, persistent headache and blurred vision is an indication of possible preeclampsia. So we need to get them into the office and assess them while they're already at the clinic. We need to assess their blood pressure. We need to do a urinalysis. We need to see if they've got protein in their urine and all what's going on with that. I have sort of harped on preeclampsia in these last 3 videos because y'all, good chance you're going to get a preeclampsia or a postpartum hemorrhage question on the NCLEX, because those are 2 of the biggest complications associated with pregnancy and delivery. And so they want to know if you know how to manage those. Okay. So make sure that you know the signs and symptoms of preeclampsia. During a prenatal visit at 36 weeks gestation, a client mentioned she's having difficulty sleeping at night. Which additional symptoms should be reported to the healthcare provider? So insomnia is an expected discomfort in the 3rd trimester. Okay. Fatigue and increased sleeping is common in the 1st trimester, but in the 3rd trimester, insomnia, and it's often associated with just physical discomfort, not being able to get comfortable. So what it's saying here is, what else? She's complaining of that, but what else? This doesn't need to be reported. So what else do we need to report? Leg cramps relieved by stretching. That's a pretty common expected finding. Perineal pressure when standing. Y'all, you got the baby pressing on the perineum. They're going to feel perineal pressure. It doesn't feel good. Spider veins appearing on the legs. Y'all, that's expected during pregnancy. It's increased plasma volume. And that's what happens. Vaginal bleeding and abdominal pain. Y'all, you do not expect vaginal bleeding and abdominal pain. Okay, we're going to report that for sure. For sure. Now, what I don't want you to say is, well, doesn't the doctor need to know about everything? Okay, there's a difference between charting something, right? Charting something so the doctor can see it and they see the assessment that you made, and actually saying to the doctor, hey, I got to tell you, they're having this unexpected finding. One of the main things that the National Council of State Boards of Nursing wants to know is, can you identify changing assessments that are bad changes, trends in the wrong direction, and unexpected findings? If you know to look for those 3 things, you're going to get probably a third of the questions right on the NCLEX. There's going to be a ton of questions and like that. And people always put comments, under my videos. Is this really the way the NCLEX questions are? Pretty close. I don't write for the NCLEX, but I'm telling you, these are very, very close to the way you're going to get. When I write these questions, I try to make them as little amount of information as possible, because that's the way the NCLEX is. They're very vague. They give you very little information, and then they expect you to write an answer, and you have to be able to know the rule that you're using when you answer the question. A client at 30 weeks gestation expresses fear about the upcoming labor and worries about losing control during delivery. Which response by the nurse is more appropriate? This is very common. Women, especially their first delivery, they're worried about how their body's going to look. They're worried about how their partner's going to see them. They're worried about pain. How is this going to be managed? Am I going to be able to make it? So it's a very common thing. So the answer to I'm going to read the answers, but I'm looking for the therapeutic response. Okay. Now, if there's no therapeutic responses and all of them are just presenting facts, then we'll have to reassess the question. But I'm looking for the therapeutic response. Let's discuss what aspects of labor concern you the most. Labor is a natural process that women have been going through for centuries. You should attend childbirth classes to learn what to expect during labor. Focus on enjoying the rest of your pregnancy. Okay, B and D discount what she's saying. She's telling you about a fear, and you're kind of brushing it aside. Oh, it's just a natural process. Don't worry about it. Oh, focus on something else, right? B and D does not address her concern. A is encouraging her to talk about it, which is therapeutic. That's therapeutic. Now, C might be helpful, but there's 2 things about C I don't like. I don't like the word should. You should attend. That I don't like that word. That's a red flag word for me. and it's putting off her concerns. So instead of saying, I'll talk with you about it, because one of the things about therapeutic communication is addressing their concern now instead of saying, let's talk about it later. Now, if there's no option to talk about it now, then you'll have to choose talk about it later. But if there's an option to talk about it now, that's your most therapeutic response, unless it's just an inappropriate statement. But A is a very therapeutic response. It's encouraging her to talk. So when you get a question that is a therapeutic communication question, look for the answer that encourages the patient to express how they feel. All right, that's a pretty good rule of thumb. Are there exceptions to that rule? There's always exceptions, but I'm telling you, you're going to get more questions right than wrong as it relates to therapeutic communication if you encourage them to talk about how they feel. A pregnant client in her third trimester reports frequent nighttime urination disrupting her sleep. What is the best nursing response? Limit your fluid intake throughout the day to reduce urine production. Use the restroom before bedtime and consider limiting caffeine intake. Avoid drinking fluids after dinner to decrease nighttime urination. There's not much you can do. Frequent urination is unavoidable at this stage. All right, frequent nighttime urination or frequent urination is expected because of the baby's pressing on the bladder. So the bladder just can't hold as much urine before you feel like you got to go. Okay. However, does that mean I say, out of luck, you're just going to have to get up at night? No, I'm not going to say that. So D is out. I'm not going to say that. Now, limit your fluid intake throughout the day. A, I don't like that. They have increased plasma volume. They actually need to increase their fluid intake because they have a need for increased plasma volume. They like increase their volume by like a third when you're carrying a baby. I mean, it's a huge amount and you don't want to limit your fluid intake. So I'm crossing off A. That's just not a good answer. So would it be better to use the restroom before bedtime and limit caffeine, or avoid drinking fluids after dinner to decrease nighttime urination? So B, I don't like because I don't know that they even drink any caffeine. Do not assume they're doing something bad unless they tell you they're doing something bad. Like, don't assume that they're drinking caffeine. Don't assume they have a lot of salt in their diet. I mean, sometimes those are the right answers, but let me tell you what, I've told you this before, the right answer is the right answer because of the other answers. If absolutely everything else was a bad answer, I could pick B. If everything else was a bad answer, but everything else is not a bad answer. A and D are bad answers, but C is a good answer. C is your classic answer for decreasing nighttime urination. That's what the same thing we teach men who have an enlarged prostate and have to get up at night and go to the bathroom. We say avoid drinking fluids after dinner. Y'all, this is a fundamental question wrapped up in a maternity scenario. They're testing whether you know how to teach people to avoid nighttime urination, because it's the same exact teaching, no matter the underlying cause, if we want to reduce nighttime urination. So, okay, during a prenatal visit at 36 weeks gestation, a client complains of irregular contractions that become more noticeable in the evening. What is the nurse's best explanation? Irregular contractions. So irregular contractions does not mean they've gone into labor. Okay, regular contractions. If she says I'm having regular contractions that are 20 minutes apart, I'd go, sounds like you've gone into labor, but that's not what she said. Irregular contractions that are more noticeable in the evening, which means after they're tired. Okay, and that's the kind of the definition of Braxton Hicks. These are Braxton Hicks contractions, which are normal and help prepare your body for labor. That's a true statement. You may be in early labor. You should go to the hospital immediately. That's not true. Irregular contractions does not mean early labor. Irregular contractions indicate fetal distress. We'll need to monitor the baby closely. No, that's not what it means. You should avoid all physical activity to prevent these contractions. Absolutely not. Don't tell someone to avoid all physical activity. Now, we might put somebody on bed rest if they're in preterm labor or preeclampsia. Preterm labor, preeclampsia, we're going to probably do bed rest, but she's not in preterm labor. There's no evidence she's having preeclampsia. So I'm going to teach her what's going on. Those are Braxton Hicks. A client at 32 weeks gestation is experiencing leg cramps at night. Which recommendation should the nurse provide to alleviate this discomfort? Increase your intake of dairy products to boost your calcium levels. Okay, hypocalcemia is not a cause of leg cramps. It could be hypokalemia, possibly. Sometimes that can cause leg cramps, but not calcium. Massage your legs with warm oil before bedtime to improve circulation. Yeah, I've never heard of that before. Maybe if all the other answers are bad, I guess maybe. But I've never heard of that before. Flex your foot upward when a cramp occurs and consider moderate exercise. Okay. I can just tell you from experience that works. So I very seldom like to answer questions based on my own personal experience, but I know C works. So I'm going to keep it on my list. Reduce your potassium intake by avoiding bananas and oranges. All right. I don't like that answer because it could be hypokalemia. And if I reduce potassium intake, that's not helping. So I'm crossing off A and D. So B is something I've never heard of before. And C is something I have done before. I think probably everybody's done that before. You get a Charlie horse in the middle of the night. That's what we call it in the US. When you get leg cramps at night, call it a Charlie horse. I have no idea where that word came from. But anyway, so I'm picking the one that I've heard of before. So what I'm talking about is using common sense. This is just common sense. This is not something I learned personally. And there's two answers that are clearly wrong and one other answer that I've never heard of. So could I have answered this incorrectly? Could I have gotten it wrong based on the reasoning that I used? I could have gotten it wrong based on my reasoning, but at least I have a reason. I have a reasoned way of answering this. I'm not just guessing. So that's what you want to do. You want to have a reasoned way of answering questions. Don't just guess and use your common sense. At 33 weeks gestation, a client expresses fear about the upcoming labor, okay, and concerns about pain management. Which symptom reported by the client should be immediately communicated to the healthcare provider? All right, I'm not sure where this question is going. They have fear about the upcoming labor and concerns. Which symptoms should be reported immediately? Okay, sensation of pelvic pressure and lightening. No, it's a little early for that, I guess. Pelvic pressure at 33 weeks. That might be a little early, but there's nothing really concerning about that. It could happen 5 weeks before they deliver. Braxton Hicks contractions after physical activity. No, I'm not worried about that. Difficulty finding comfortable position to sleep. No, that's expected. Sudden weight gain of 5 pounds in 1 week. Yeah, I'm concerned about that. Now, I've told you that if you get a complications question as it relates to pregnancy and labor, it's probably going to be preeclampsia or postpartum hemorrhage. And I'm really harping here on preeclampsia, but sudden weight gain, sudden edema, persistent headaches, protein in the urine, high blood pressure. These are symptoms of preeclampsia. So you need to show the National Council of State Boards of Nursing that you have enough sense that when someone complains of something that sounds like preeclampsia, that you need to follow up on that. During a routine prenatal visit at 35 weeks gestation, a client mentions she has developed spider nevi on her face and chest. Which accompanying symptom is cause for concern and should be reported? So basically, it's saying to you that she's got spider nevi, and that's expected. And spider nevi are expected in the 3rd trimester. So that's an expected discomfort. What is unexpected? Because we report unexpected findings. Severe right upper quadrant pain. Okay, I don't expect that. Nosebleeds. Nosebleeds can occur. They have increased plasma volume, increased pressure, just kind of in their body. That's why they get varicose veins and spider nevi. So yeah, that's expected. Heartburn after eating spicy foods. Well, that could happen to anybody, but yeah, certainly when you're pregnant. Braxton Hicks contractions in the evening. That's when they most often occur because you're tired. They're tired. So I am most concerned about severe right upper quadrant pain. Now, just so that you know, there's a type of preeclampsia, a very serious type of preeclampsia that can cause an enlarged liver. I'm not going to go into all the pathophysiology of it because you don't need to know all that, y'all. You don't have to bog your brain down with all kinds of pathophysiology information that you don't already know. You just want to focus on the facts that you need to know and testing strategies. So severe right upper quadrant pain, the liver's in the right upper quadrant. And so if they have liver pain when they're pregnant, I would be concerned about that because that can be associated with a very specific type of preeclampsia that is quite serious. A pregnant client is worried about losing control during labor and delivery. Which nursing action is most appropriate to help alleviate her fears? There should not be quotations around these. These are not statements. These are actions. Okay. Nursing action is most appropriate to help alleviate her fears of losing control. So remember, I said you want to get people to talk about it. But if the option to get her to talk about it isn't there, then you have to reevaluate. So let's see what answers are there. Encourage her to create a birth plan outlining her preferences for labor and delivery. Advise her to leave the decision-making to the medical team to reduce stress. Suggest she avoid thinking about labor to decrease anxiety. Tell her that labor rarely goes as planned, so flexibility is important. All right, there's no option to encourage her to talk about her fears. Since there are no options to encourage her to talk about her fears, we're going to have to look for something else. Now, is there anything here that we just don't like? Well, I don't like C at all. Suggest she avoid thinking about it. Yeah, that's not therapeutic at all. Advise her to leave all the decision-making to the medical team. In the U.S., y'all, if you're testing outside the U.S., you may not realize in the U.S., autonomy is all one of the highest American values. And so we don't ever tell people to leave it to somebody else. So B is a bad answer in America. So we're crossing off B, we're crossing off C. Tell her that labor rarely goes as planned, so flexibility is important. I mean, that's not really true. Usually labor goes as planned. I mean, it may go a little faster, but it usually goes as planned. I don't think that's a true statement. A, encourage her to create a birth plan outlining her preferences. That's something that we're now encouraging people to do. If you don't know that, we're encouraging women to create a birth plan. So they bring that in with them to the hospital so that the caregivers can follow their birth plan. For example, they may resolve, I don't want any pain medication. So that goes in their birth plan, and the caregivers are supposed to follow that. They may say, I do want pain medicine. Well, then they're supposed to follow that. They may say, I don't want an epidural. I do want an epidural. Well, then they have to follow that. So there should be a birth plan that can help increase their sense of control, which she said she's concerned about. So that is an appropriate thing. If there's no option there to get her to talk about her fears, then I like A. A client who's 36 weeks gestation calls the prenatal clinic to report their water broke. What is the nurse's best response? So 36 weeks is just a little short of full term. 37 weeks is full term. So their water broke. Okay, if you don't know this, the water, quote unquote, is used to protect the baby from infection. So when the water breaks, it increases their risk for infection, but it doesn't mean they've gone into labor. Regular contractions means they've gone into labor. Okay, that's what tells you they're gone into labor is regular contractions. So what is the nurse's best response? You've gone into labor. No, that's not what it means. Come into the clinic so we can assess you. Well, yeah, for sure. I mean, the baby's at risk for infection now. So yeah, come on in. Come to the hospital so we can prepare for a C-section. I don't mind them going into the hospital, but I don't know why we would be preparing for a C-section. There's no reason to prepare for a C-section, especially when they're preterm. We do not like to deliver preterm if we can avoid it. Stay on bed rest at home until you're full term, and then we will schedule a C-section. Okay, that's not the best response, right? I want to assess her. We want to assess her because if we assess her, we're like, you're right, your water broke. Baby's at risk. Let's go ahead and admit you. Maybe we're going to start her on antibiotics 3 times a day or something. I don't know. I mean, I'm not an expert on this, but my guess is they would admit her and monitor her, give her antibiotics to prevent any kind of infection from the water breaking, and wait until she goes into labor or induce labor when she's full term, depending on kind of the provider and the mom and their birth plan and all that kind of stuff, right? So, okay, that is that. I hope you found the dangers and discomforts of pregnancy helpful to you. There's a reason why I did the video right before this series I did the prioritization video where I talked about the unexpected finding. And then I went into these dangers and discomforts of pregnancy so that I could show you how you can use that prioritization strategy. And also so that I could teach you along with the blue book about the dangers and discomforts. The dangers are the unexpected things. The discomforts are the expected things. All right. So I hope this was helpful to you. You can buy the blue book on Amazon. You can get the blue book app at clinicreviews.com. Hope you have a great rest of your week or the weekend or evening or day or whatever it is for you. Love you guys.